I am Dr. Sharad Sheth, Head of Nephrology Department and Kidney Transplant Unit, Kokilaben, Dhirubhai Ambani Hospital, Mumbai. Today, I shall be talking on a very common topic of edema. The edema, in simple terms, is called swelling, and this happens because normally fluid is in the intravascular compartment circulating in the body along with the blood. But in certain conditions, which I shall discuss further, the fluid from the blood compartment leaks out into the tissues and then it produces so-called swelling of the tissue, and that is called edema. These edemas can be of various types. Peripheral edema, where it is in the limbs. The pulmonary edema, where the fluid accumulates in the lungs. Cerebral edema, where it accumulates in the brain cavity or in the brain, which is tightly kept in the skull. And there is a lymph edema, where there is, because of damage to the lymphatics or the lymph node, either due to cancer or radiation or chemotherapy, it accumulates selectively in the area where it is drained by the lymphatics. So most of this edema is venous edema, and the causes can be from local allergic cause to organ involvement cause. The commonest organs involved could be heart, that is the cardiovascular system, the kidney, that is the renal excretory system, or liver. And as I said, this fluid which exudates out into the tissues is normally kept bound in the blood in the intravascular compartment by the help of proteins. So when the proteins also become less in the body, it can manifest as generalized edema. If the edema can be of again various types, if it is associated with redness or warmth of the skin, that is indicative of inflammation, it is an infective edema which can be as a result of say mosquito bite or a bee bite or any injury into the body, which results in producing edema, infection in the subcutaneous tissue. Most of the edemas are pitting edemas, wherein when you press it with the thumb, the pressure impression persists, and that is pitting edema. And there can be non-pitting edema. Commonly, the lymph edema, where the lymph accumulates, is non-pitting, while the venous edema, where the tissue fluid accumulates, is pitting in nature. So, when it is of cardiac origin, usually it is indicative of a valvular heart disease or the cardiomyopathy, that means the muscle of the heart is weak and is unable to pump proper blood into the tissues. So there is a backflow of blood because heart is unable to pump the blood, and that backflow results in edema. I, being a nephrologist, most of my patients are edematous because I know kidney as a filter is the most vital organ to get rid of the fluid from the body. In all kidney conditions, especially when the kidney insufficiency or kidney is failing, there is invariably edema all over the body. And usually it is on the dependent part of the body. If a person is in the upright standing position, it accumulates in the legs. But if a person is lying down most of the time, then it accumulates on the face. And that is in the early morning, because overnight person is in the lying down position. So early morning there is edema of the face or the facial edema. And the leg edema is usually in the later part of the day when the patient is upright and mobile and then due to gravity, the fluid collects into the lower limbs. Now, in hyperproteinemia, that is in mainly liver conditions, because liver synthesizes albumin, and in liver conditions there is decreased albumin or protein in the blood, and the edema develops. And this edema is more in the abdomen, around the surrounding the viscera, and that is called ascites. The cardiac edema is mainly pulmonary. That means the edema mainly is in the lung tissue, and this gives rise to severe breathing difficulty, and sometimes one has to get admitted in emergency in the hospital and get it treated by certain drugs. If not, then we have to put on ventilator. The commonest way of treating this edema is by what are called water pills, or we call it in medical terminology as diuretics. So these diuretics, they excrete the extra amount of fluid accumulated in the body through urine. And the best way of knowing that a person has accumulated fluid, that means like edema is likely to happen, is to check the weight every day. The edema can be occult or non-manifest many a times, even when the person collects almost up to 3 liters of extra fluid in the body. It may not be visible as an edema on examination. So daily weight is very easy way of finding out excess of fluid in the body, which later on will get manifested as edema. Then one has got tightness of clothes, inability to wear trousers or stockings. If there is edema on the feet, stocking wearing is a difficulty. If there is ascites or edema in the abdominal cavity, then wearing trousers or buckling the trousers is difficult. And this edema is not uncommon, it's quite a common condition, especially in kidney disorder. It's the commonest. And the second other organ being involved are liver and the heart insufficiency. Sometimes there is a localized edema, and that is lymphedema. When there is a patient of cancer you have treated or you have operated and undergone major surgery, where the lymphatics or the lymph nodes are removed or they are blocked, that can produce lymphedema. Lymphedema is difficult to treat. It doesn't respond to diuretics. But the normal edema is because of the fluid exuding out from the vascular system, and that is very easily amenable to treatment with so-called diuretics or water pills. Friends, this talk is to give you the basic understanding and impart you the knowledge about what edema is, and this is going to help you in understanding and treating any person whom you encounter with edema. Thank you very much for your kind listening.